Smoking strong pot daily raises psychosis risk, study finds. London use smoking high-potency marijuana every day could increase the chances of developing psychosis by nearly 5 times, according to the biggest ever study to examine the impact of pot on psychotic disorder rates. The research adds to previous studies that have found links between marijuana and mental health problems, but still does not definitively pinpoint marijuana as the cause. Psychotic disorders in which people lose touch with reality are typically triggered by factors including genetics and the environment. But experts say that if researchers at King's College London and elsewhere analysed data from a dozen sites across Europe and Brazil from 2010 to 2015. About 900, the scientists estimated that people who smoked marijuana on a daily basis were 3 times more likely to be diagnosed with psychosis compared with people who never used the drug. For those who used if De Forty and colleagues estimated that in Amsterdam, about half of new psychosis cases were associated with smoking high-potency pot. Gage noted that it was possible that people with a family history of psychosis or other risk factors might be more susceptible to developing problems like psychosis or schizophrenia if they used cannabis. That related video: Alabama lawmaker pushing for legalized medical marijuana, provided by WVTM-TV Birmingham.
Raindrop, drop top, smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park pot.